All, thank you very much for tuning to our channel today. I want to talk a few minutes about Morton's neuroma. It's also known as intermetatarsal neuralgia. Now, let us start first of all with what exactly are the characteristic signs and symptoms of this disease, and then the diagnostic features, and finally the treatment. Morton's neuroma is a common cause of foot pain. It's like an entrapment syndrome, and it is due to the inflammation of the nerve, and finally the neuropathy. That's why we use NSAIDs and the measures that relaxes that pressure over the nerve, and sometimes we even give the steroid injections. So the treatment, if you think of treatment, you can actually think of pathology or vice versa. So basically this is a neuronal problem due to pressure over the interdigital nerves. Now let us go from signs and symptoms. This is interdigital neuroma. Remember that name. An interdigital neuroma, and it's a painful condition involving the plantar aspect of the forefoot. So the pain is in the plantar aspect and in the third interspace. Remember that point. If it's not, it's very rarely occurs in other interspaces. So in the plantar aspect of the foot, and the patient complains that the pain is in the third interspace. The symptoms are usually aggravated by walking and relieved by rest. So patient says that walking always makes it worse. So when you give these patients some nice shoes that actually give more space to their foot, they get relaxation from that problem. And it occurs like mostly in women, like 10 times more frequent in women. So you use because these high fashion shoes that with the high heels, they also contribute to this problem beside the anatomical variation between men and women. So it is most common in women, and it's most common in people who wear tight fitting shoes. Now that the constant traction of the ligament, you see that tarsal ligament, metatarsal ligament, it produces that pressure over the nerve. So the theory that explains the higher incidence of this problem in women. The pathological changes, they actually involve actual degeneration of the nerve fibers associated with deposition of amorphous eosinophilic material that is felt to be consistent with an entrapment neuropathy. So this is an entrapment neuropathy with the deposition of eosinophilic material. So remember, the pressure is being applied on a particular interdigital space that is leading to the entrapment neuropathy. Now the patient, because of this, the patient actually complains of that interdigital pain, and that interspace neuroma, it causes that localized pain in the metatarsal head region, but always differentiate it from metatarsophalangeal joint pain that is different from neuroma. So neuroma is an entrapment neuropathy. It has nothing to do with the metatarsophalangeal joint arthritis. That pain could resemble, and one of the causes in the differential diagnosis of Morton's neuroma, but it is entirely distinct from this problem. So the narrowing of the intermetatarsal space and compressing the mass often reduces the patient's symptoms. So if you, for example, while examining this patient, if you actually press on the third interdigital space, you can actually feel that mass in a chronic condition. We call this Mulder click. So remember that, Mulder click. And so that's a characteristic sign of this disease. And if you see that in your question, that is Morton's neuroma. Now, the metatarsophalangeal joint, as I said, it can actually cause a referred pain into interdigital spaces. So try to differentiate these two things. And sometimes synovitis can cause similar pain. Sometimes avascular necrosis of the metatarsal bones can cause the similar kind of pains. So sometimes mechanical instability, sometimes synovial cysts. So the differential diagnosis has all those conditions, but the characteristic points are pain that comes with walking, relieved by rest, and increasing with these ill-fitting shoes, and decreasing with nice spacious shoes. And if you are feeling that mass in the interdigital space, that is mold or click, those are the characteristic signs of Morton's neuroma. Now, you don't have to do any diagnostic tests, because most of the times you can actually identify the patient's problem just by listening to their story. But you can, there are some people go for ultrasound, but it is user dependent. Some people go for MRI, but it's unnecessary and an expensive procedure to do. So mostly the diagnosis is by clinical history. So coming to the treatment, you use a soft-soled shoes. So when you give a soft-soled shoes with spacious, like more room for the feet, then patients get relaxation. And the pain actually, if you should also give rest to these patients, and that gradually improves. And then you start these patients on non-steroidal anti-inflammatory drugs like Mobic or naproxen, and they get relief with these measures in many cases. You give rest, you give application of ice or NSAIDs, and those are the things. And you can also give steroid injections straight into third space. And you can also finally, if these treatments do not work, you go for a surgical treatment, like you go like from the third interdigital space, from the dorsal side, you go into that metatarsal ligament, and you cut the metatarsal ligament, and the nerve is just beneath the metatarsal, that transverse metatarsal ligament. So you go down and you cut the nerve after its bifurcation. So all these measures are NSAIDs and rest and ice and steroidal injections and surgical treatment while cutting the nerves. All these things can help the patient, but most of the cases you will be surprised that just by changing shoes and giving an NSAID give relief to these patients. So that's about Morton's neuroma, and I want you to take a moment now to ask you to go to my website at www.drpaul.org. That is www.drpaul.org. Please visit our website. We post daily videos, and I also encourage you to read USMLE Smasher if you are going for clinical skills examination. I really recommend this book, USMLE Smasher. It is very well written with so many tips. You don't have to waste your money on expensive courses. Just by reading this simple book, you will pass your clinical skills examination. So this is Dr. Paul. Thank you very much, and have a nice evening.